Hello, 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 friends. Happy Monday. It is Monday in a nurse's life. And this is your hostess, Sharon Robert, coming to you live from Power in Nursing Innovations. Of course, it is about you. And today, we're doing a follow up from yesterday. If you missed yesterday, we talked about a physician's report. Yikes. It was about suicide and the relationship to the COVID pandemic. And you all know that was a little bit ago. But even still, there are some factors that are still popping up their heads. We want to know what has happened with nursing. So today, our topic is nurses and healthcare workers, suicide report related to COVID-19. And we want to dig, because we want to know who, what, where, when, and why. Did you all ever know about those couple of W's when you were growing up? So our focus is on the pandemic and the effect on nursing, on careers and professions. And you will find you know quite a lot because you've been there. You've been there. So let's talk about how we understand some factors that really impacted or influenced the profession of nursing. So, what can you think about right now, even if it's something that is not so happy? I don't want you to be bogged down, but just remember these things are real and they've been real. So, our topic today is about where we are now, based on some of the things that have occurred during the years of the COVID pandemic. So, we'll talk about stressors. We'll talk about stressors. And we'll talk about, as we said, those W's, those when, where, why, what, all of that. And the impact of the COVID pandemic on the career paths of many of you. Some of you are still in nursing and some have left. And you might know some of those people. But we'll also remember that as things occur, even if it's not good, we learned something from those occurrences. So we're able to create strategies to prevent those horrible occurrences from happening again. And who wants to go through this stuff ever again? No, we don't. But we learn as we go and we learn as we grow. So let's talk about a little bit. Where did all of this started? If we're in a place today where many nurses have left the profession, how did all this start? It started with COVID, COVID-19, the virus. And we don't have to go through all of the, it started in China and who said what, why, what. We're not going to go right there right now. We're already in the place where it has occurred. And the virus has morphed into a pandemic. So, mental health is a really huge component of the occurrence of the pandemic because you could not wish it away. You could not grow it away. You could not sleep it, drink it, eat it away. We know that some of the occurrences of the pandemic were huge factors in the way that nurses served, because we serve to save health and wellness. Those are the things that are right on our minds. Yes? But with the COVID pandemic came some increasing stressors. Now, we already had staffing shortage and so many other things that have been a part of our lives for many years. But now we have increased anxiety during the COVID experience. Anxiety, depression, and even at the end of the pandemic, oh, if you have been so blessed to be alive, you may still be post-traumatic stress, PTSD, for all the things that you have gone through. And even though that was several years ago, and the pandemic officially ended in 2023, people just stopped talking about it. They stopped talking about it. COVID's over. Well, we know it really isn't, but we also know that healthcare workers, EMTs, every person or role or position that was related to service and care for any organization, any setting, any patient that was dealing with COVID, you have been affected. You have been affected. And depression is not a joke. It is not a joke. And long COVID is not a joke. But people stop talking about it. They are going back to their own places or spaces, just wanting to wipe that all away. But remember that the physical impacts of COVID were extensively studied after the pandemic. But that means they're studying us, right? They're not studying the persons that were not related, never had a thought, never had a family member or friend that asked a question or had a symptom. We know that physical and mental health were huge repercussions. So we want to know today, where are our persons who had been in place to care for persons that needed health and wellness support? Those persons, some of them are still here, some of them have passed away, and we are still here struggling with the stressors and with anxiety. Who can help us get through? Who can help us get through? Some of you just said, too much, no more. And you've left the profession. That is one of the paramount places of study. How many nurses have been affected, and how many nurses left the profession, and how many stayed. Those are the numbers. That's the data that we're looking at. And as we factor in the numbers of nurses that just couldn't take it and they have left the earth, they have committed suicide. And many other people have as well. But of course, we know that we have been in the thick of it. Healthcare workers are in the thick and have been in the thick of the COVID pandemic. Nurses, physicians, paramedics, EMTs, other frontline staff couldn't just throw in the towel and say, I don't want to do this anymore. So the focus of our search today had been, what about nurses? And what about the focus on nursing, the profession? So, what about nurses? Who are nurses? Remember, I said the W's. Who are nurses? We do know the truth about nurses. Most nurses are females. From way back, it started as men on the battlefield in Crimea who helped remove the injured or fallen persons from the field to another place or space. They didn't leave the injured persons or comrades on the field. They removed them. And by, here comes Florence Nightingale and others who took those spaces and helped serve and care for the wounded comrades. Well, if you know you are a nurse and you know now, even if you didn't before you signed on to be a nurse, that you would come to a place where you may wind up in a place where there are people who are sick and dying, and those that have died. Did you know that before? Did you know how you would take care of yourself during that time? How would you make it through? And even in nursing, as we go through some challenges related to deaths of others, you're not really ready. You're not really ready until you see, feel, hear, touch those circumstances. And many of us weren't ready, and many of us tried to be ready, but it is a trauma. It is a trauma to deal with a dead person, a dead body. Many nurses have not been able to make it through. And it's not normal to be the, oh, champion, I made it through. Many nurses have suffered and committed suicide. But remember, there are so many nurses who are women, and we not only often serve in nursing, but we serve in our homes with our families and our children and our communities. A high rate of women are mothers, caregivers, and nurses. So there's a higher rate of the community's connection with the nurse, who is a caregiver in the home and in the workplace. So remember, those persons, those nurses are highly vulnerable to the trauma and the stressors. And as we say, one of our little mantras, that nursing is the backbone of healthcare. Nurses are identified as the greatest number of women serving in the healthcare system. So we're here. We're here a lot. Days, nights, weekends, holidays, we're here serving. So we are subject to the times that aren't always happy and that can potentiate huge times of stress. So we are not prepared physically or mentally. You can't be. There is no pill for being prepared for death in any circumstance. So nurses face those times, and death is really, I will say, an occupational hazard. It is, but it does not remove us from the space of working long hours, not having enough resources, as I heard even on the news yesterday. There was a comment about how hard and how much nurses work without appropriate resources. And the newscaster actually mentioned back in the days of COVID when nurses wore trash bags to represent the places and spaces where they would serve that did not have the appropriate resources. Those would be isolation gowns. But you have to cover yourself when you're in the places of viruses and bacteria. No one would expect that the organizations wouldn't have sufficient resources. But how do you cover yourself and keep yourself clear of those viruses and bacteria? So we have to wonder, what shall we do? We can't just go home. We can't just say, I'll do it tomorrow. So there have been lots of times when nurses were facing outrageous stressors, many of them that they hadn't met before. So at those times, people suffered. The caregivers suffered, as well as those persons who were seeking care and service related to contracting that COVID virus. Well, the many, many stressors in the workplace were huge challenges. And how do you meet those challenges without falling down, without going to the cliff, without trying to soothe yourself with substances that can calm you and help you feel better, help you cope? And those aren't items that are prescribed for you in the course of your 12 or 16 hours of your work. And during that time, there may be long hours of space before you can eat, before you can drink water, before you can take a breath and go to potty, because your patients are suffering very, very dramatically symptoms of COVID. They're coding, they're crying, they're dying, and you can't get a pill for that. You can't get a pill for that. And it's happening again, and again on the next shift, and again on the next day. So, what do people do? We're human. We are human. Nurses are human. And it is not a place that you want to stay in all day, all evening, missing your family, missing your kids, recitals, missing making dinner with your kids, listening to how their day was. That's a stressor, a stressor. And nothing was set for you to be able to cope with these stressors. So during that time, what do you do? Now, I've heard, once upon a time, I've heard that During the process of the COVID pandemic, no one knew it would be several years, but organizations indicated that they would have a place for nurses to be ready to de escalate because everything was awry. No resources, no staff, more staff that were sick, more staff that contracted COVID, staff that just quietly resigned. How would you manage in the organization to care for the patients without enough staff who weren't sick? Well, no one expected that. And there's no cure for the unexpected. There was no cure. So COVID raged through many of the organizations. And as nurses, the direct caregivers on the front line fell ill, the stressors raged on and on and on. And in the U.S., our count for sick patients and patients that died was up to the millions. Well, even though data says that there are, or there were at the time of COVID pandemic, 4 million registered nurses in the United States, those numbers really, really, really went down. So, even still, if there had been 4 million before, the numbers dwindled. Nurses got sick. Nurses even died. And the stressors were still there. And they increased because now there's mandatory overtime because there are not enough staff to care for the sick patients. Well, what happens? What happens to the staff? What happens? How do we manage? How do we manage? What are the key factors that lead to the increased risk of losing your healthcare staff? The patient loads are increasing. The ERs are full. The beds are full. And there aren't more nurses. The patient load is increasing. And the nurses are burned out. The nurses are burned out. And as we just mentioned right before about the resources, there are fewer and fewer available resources. So we don't have protective gear. On top of the fact that there aren't enough people, not enough staff. We talked about mental health and emotional tolls of all of the stressors. Who can say it's a good day for them to, as a healthcare provider or worker, that you're okay with dealing with death and trauma? And what about who dies? Who dies? Who gets to make those decisions about who dies? And in this profession of many, many women who are serving in nursing, we said these women are serving in other places except the front lines. We may be faculty. We may be in the risk management scenario. We may be in other places Nursing profession and career path is widespread, and it can include up to 100 positions. There are so many. And they're not all in the ICU, and they're not all on the med-surg floor. So nurses are in spaces and positions that aren't direct caregivers. But sometimes the nurses have been pulled from their roles, for a matter of fact, nurse practitioners, to serve in the ICUs. Well, maybe they haven't been in the ICU for a few months or a few years. And now they are asked or required to serve at the front line. That is really a challenge. And how many folks would feel comfortable if you've served in one space? Maybe you have served as the nurse practitioner on the oncology floor, and now you're required to work in the ICU or in the post-op unit. It's not easy. It's not easy. So remember, there are, unfortunately, so many stressors that will drive persons to a place and space that is not safe. It is not safe. Who leaves home for work every day and imagines that 3 or 4 of their patients today will die? It is a place that leads to higher suicide risks. That's not what you signed up for, you say. That's what you expected. And remember, it isn't a place that either has the time and place to help you soothe your stresses and or get off the ledge. It's not a place for you to deal with your mental health challenges because there's not time. There's not time, and there's not enough resources to give you a chance to come back off of the ledge. And unfortunately, I've had the opportunity to meet with a young lady who shared the story about one of her staff who went on a break, and they wondered, well, the break is taking a little bit longer than we expected. The person wasn't in the cafeteria. They hadn't clocked out. And unfortunately, as they decided, well, we're going to have to look for our staff person because it's way too long for them to be missing. But they found that staff person in the stairwell. And they had decided that this was not going to be a day for them to be able to cope with the stressors that were occurring during the day. And they took their own lives. That isn't what we want, and that isn't what we expect. But we must know that these truths are unexpected, and the challenges and the stressors were unexpected, and we were not prepared to be able to help the staff cope. And as we are in 2025, we must prepare our next group of care providers to get help. Don't do it alone. Don't do it by yourself. It is not what we expect that you will be ready for, because many of us still aren't ready, even though we've been very, very close to burnout, and it's not a good or fun place. So find your help. Don't go alone. Don't do it alone. And remember, you are irreplaceable to your friends and families. They don't want to lose you by you being quiet about what is bothering you and what you are going through. Here at Power in Nursing, we are a coach forum. We will help you work through some of the challenges, because no one should go through this enormous level of stress alone. There is no magic pill. Let's work together. Together, we can change everything. We have got to do better for each other every step of the way. Be well, my friends. We are here for you. Talk with your leaders. Talk with your loved ones and your colleagues. You all deserve to be saved. You will save each other, because you now know that there are circumstances and strategies that can help you cope and be well. Be alive. We've got to help each other every step of the way. It isn't magic that new nurses will appear with answers to everything. Be well, my friends, and help each other. It is time out for quiet resignation. We have got to save each other. Come on, come on, come on. We will help the new grads also, as we help them learn how to serve and save. And it's not just for the patients. It's for you. And we are here for each other. So learn to love yourselves as you serve and save. Come on by. Power in Nursing is right here for you. And you can meet us by contacting us on the website, but you can also send us an email. powerinnursing6, the number 6, at gmail.com. We have several strategies that we've helped people employ to find the way back off of that ledge. You've got to acknowledge your pain. It is pain. Burnout is pain. Challenging stressors is pain. Let's not go out that way. Learn how to find the way back from burnout. Overcome those stressors. We'll work together. And as you all know, as I say, sharing is caring. So let's get together. 2025 has already started with measles in Texas. Who wants to be in a place and space where no one knows the answers to healthcare challenges and no one wants to take time, energy, and money to find the answers? This will put more stress on the healthcare workers. So let's get started serving and saving ourselves. We come together, and yes, we can. Be well, my friends. We will talk with you soon. We'll be back, and we'll be back again, and we'll be back again. Nurses' lives matter. We'll see you soon. Be well, my friends. Be well.